There are so many different ways to exercise your body and improve your health, but when it comes to low back pain, there are 3 exercises that almost all practitioners can agree upon. In this video, we'll be highlighting exactly what makes these 3 so unique, as well as going through each of them in detail. As per usual, let's start with the anatomy. One of the more common reasons to experience long-standing, non-specific low back pain is due to a lack of core stiffness. Some people will describe it as core stability, others core strength. My personal choice is core stiffness. Now, because we do not have a rib cage in our lumbar spine, we are completely dependent on our core musculature, which includes all the muscles wrapping around our core, to hold us steady during movements. Now, the good news with this is given enough time and practice, we do not have to consciously engage our core with all of the movements that we do. It takes about 6 to 8 weeks in order to achieve a mechanism known as neural adaptation. For more context, you can watch the video up there describing it. Our core is consistent primarily of 3 muscles. They are our front muscles, known as the rectus abdominis, or our traditional abs, our obliques, which are located on our sides, and our quadratus lumborum, or QLs. These ones are located in our backs. There are other muscles that help to compose the core, but these are the 3 that we'll primarily be focusing on. Each exercise that we'll be going through corresponds to a different muscle group. Whichever exercise you find to be most difficult likely corresponds to wherever your stiffness is least. The reason these 3 exercises, collectively nicknamed McGill's Big 3 after the researcher Stuart McGill, who's done so much in-depth study around them, are so highly regarded is due to the very low shearing forces that they put through our spine when completing them. This is in comparison to some other common core exercises that some people may do instead. A few quick disclaimers: if the core exercises you prefer doing aren't in this video, that doesn't mean stop doing them. Any exercise is going to be better than no exercise. And as I feel I've said 1,000 times, the best form of exercise for yourself is the type that you enjoy. And as always, before you jump into doing these exercises, please go get a physical examination done by a healthcare provider that you trust. There are some conditions and stages of acute pain where doing these may further aggravate your condition. If your complaint is found to be either non-specific or related to core stiffness, you're probably good to go. So let's get into them. The first of 3 is known as a bird dog, which targets our QLs or our quadratus lumborum. Begin this exercise on all 4s. Slowly extend one arm and your opposite leg, both in front and behind you. Take as much time as you need in order to make sure you keep balance. The intention of this is to try to stretch and reach far, not up. The cue I give a lot of my patients is to try to be flat like a coffee table. I don't know why a coffee table specifically, but it seems to work. If this is too difficult, perhaps for balance, you can try extending only one leg at a time. And if that too is still difficult, you can begin by extending only one arm. Aim to complete 10 of these on each side for a total of 20 reps. The second exercise of McGill's Big 3 is the side plank. In my own experience, this is the exercise that most of my patients struggle with. Our obliques are not very often targeted muscle groups, and therefore are also usually the culprit in cases of a lack of core stiffness. To complete this exercise, begin on your side. Keep your elbow underneath your armpit and your feet stacked on top of one another. From this position, you are going to engage your core as well as your glutes to lift your torso up off the ground. Keep the balance on your elbow and your stacked feet. Your other arm can just kind of hang out. The intent with this exercise is to create a straight line from your ankles up to your shoulder. It's also very important to make sure that your hips don't extend backwards or shoot too far forward. If you find this version of a side plank to be too difficult, you may either unstack your feet to have 2 feet to balance on, or drop to your knees where you can perform the exercise from knees up. You should aim to complete this for 30 seconds on each side. The third exercise of McGill's Big 3 is the modified curl up. By process of elimination, it targets our front abdominals. Begin by laying flat on your back with one knee bent and the other straight. Place both of your hands behind the small of your back in order to provide some lumbar support. From this position, complete a very small sit up, referred to as a curl up, by just getting your shoulder blades up off the floor. Don't aim for a full sit-up, that's unnecessary and creates the shearing forces that we're specifically trying to avoid. Also, be sure to keep your head and neck steady. You don't want to shoot it too far forward or you're going to be risking some neck aggravation. Aim to complete 10 reps on each side, changing your bent knee upon completion. In patients presenting to my clinic with non-specific low back pain, I recommend completing these exercises twice daily. I also emphasize that if a day comes up and you're unable to do it twice, doing it once is still better than doing it nonce. After around 6 weeks of consistency and dedication, we see considerable improvement in the patient condition. Once again, this is due to the neural adaptation that we mentioned earlier. And from here, it's really up to the patient where we go next. Do you want to schedule monthly check-ins? Do you want to continue with those exercises alone? Do you want to progress to strength work like squats and other free weight exercises? The only thing that I stress is mandatory to these patients is to find some way to keep active and keep moving. Else we risk losing all the progress that we just worked a month and a half to achieve. That's it, guys. If you have any questions, comments, or concerns, please, I urge you to leave them below in the comments. As always, I would greatly appreciate a subscription. It'll help me to someday get a dog. You can click here for the previous video, or you can click here for the most recent one. Have yourselves great days.